Accident victims like you deserve better. A husband and wife were rear-ended, and insurance offered them $10,000. We litigated the case and got them $375,000. Qualified expert attorneys can get you more. Call Zirkin and Smerling today.
Good afternoon, City Voters. This is Desmond Stinney, host of Baltimore City Voters Live Podcast, coming to you on this Tuesday. Is it Tuesday? Tuesday, June 18th, day before Juneteenth, and it's going to be a hot one this week. But this week is not going to be hot simply because of the weather, but there's definitely going to be some interesting things developing around town in Baltimore. We've got summer is about to be in full swing. We're following several different storylines around Baltimore currently right now, and one of those being what's happening downtown in Fells Point. We're also following closely what's going on with the 6,000 opioid overdoses that the city has seen over the past several years. And what I find interesting is how something that significant and pervasive that has gone on for such a extended period of time is really just coming to light shortly after a mayoral primary election. The Baltimore Banner has been covering this and has had, several stories about it, since the election. It's interesting how this story was being worked on for, a period of time long before the primary, but the release of it, or the initial release of it, comes shortly after the primary, which we find very, very, very interesting. More importantly, what is it that has happened over the past several years? What has our health department been dealing with that has been, whether it's knowledge or lack of knowledge of what's happening and being able to get a grip on it? What did our health department in Baltimore City know? When did they know it? How was it communicated? Who discussed it? And there needs to be a certain level of transparency as far around this issue. I mean, we're talking 6,000 deaths. We were up in arms about a murder rate that was at 300. Well, there's a opioid epidemic that's taken 3 times the lives of folks in Baltimore City, and yet we have not had any visibility into cause as far as what our government has let us know and what our health department has done to bring light to this issue. So this is going to be something that we really need to explore as a city. We know that Letitia Disraza was the health commissioner for the past several years. She recently was removed or left the health department to become, deputy mayor in the mayor's cabinet. Shortly after that, her husband was awarded a no-bid contract for redeveloping the city's website. There was a lot of discussion around the amount that we were paying for that as a city. And then shortly after the election, we learned that she's likely to leave the administration altogether. That's an interesting chain of events that I hope is explored. We've had some folks on the council discuss the possibility of having hearings around this issue. We're not quite sure what's actually going to happen, what's going to take place. We certainly want to hear from those councilmen that have committed to holding hearings. I believe Councilwoman Danny McCray was going to hold hearings, but recently I think that was canceled. Councilman and Public Safety Chairman Mark Conway had committed to holding hearings and discussing these. I'm sure the mayor's not happy about any council person holding hearings. I'm sure he's doing everything he can to throw water on any hearings around this issue that aren't facilitated by him or his office. But we need to have council people that are acting independently. We need to have council people that are acting on behalf of the citizens of Baltimore. This is a real issue that we need to have explored, from a council perspective. And I would certainly hope that the mayor is not trying to make sure that that these hearings don't go forward. But we have a lot of folks talking about this particular issue around town, as far as what some of the causes might be, what some of the answers might be. We're certainly delighted to have a couple of fellow Baltimore City residents to join the show today to help us explore both sides of that coin. So at this time, I'd like to welcome Maggie Fitzsimmons, who is where you're located down in the Washington Hill area, Maggie?
Yeah, I'm the board president for the Washington Hill Community Association.
Washington Hill Community Association.
Mm-hmm.
Excellent. And certainly I read what you wrote because this is obviously being discussed in the Baltimore City Voters Facebook group, which is definitely the catalyst for this podcast today. And I read some of the remarks that you wrote, reached out to you, asked you to if we could have a conversation about it, because I'm up here in the northwest part of the city, right? And for being a small city where it doesn't feel small geographically sometimes, but our experience with this is certainly different than other areas of the city. And you discussed with me, we were discussing how this problem could get this big, in Baltimore City. What makes us so unique in this crisis? I mean, the numbers are staggering when we compare ourselves to other cities and other areas. I mean, our numbers are, as far as the opioid deaths, are significantly higher than anywhere else in the country. What do you think is the contributing factors to that?
Well, I think the overall reason why this is happening is a stupendous lack of oversight. And I've done a lot of research on this myself prior to this, and also in the last couple of days. And I really went down the research rabbit hole because that's what it is. It's a rabbit hole of ineffective practices that are happening all over. But I'm going to give you a timeline that I think you guys are going to find very interesting. The American Disabilities Act has designated substance abuse disorders as a disorder, so it's protected under the ADA. Those persons are protected. But what started happening, so if we move forward to 2014, In 2014, and sorry for moving around because I lost my internet, so I'm talking to you on my phone right now, so I could be there. So sorry for the movement.
No
Um,
worries.
so starting in 2014, the ACA began accepting Medicare and Medicaid to treat substance abuse disorders. So prior to that, um, people who could not afford this rehabilitation treatment. In other words, some people need to spend some time, living in a different place, living in one of these centers to get treatment. So prior to 2014, if you couldn't afford it, you couldn't get the treatment. However, once Medicare and Medicaid started being accepted, the doors then opened for anyone who needed treatment to get treatment, right? But what happened if we move forward? So let's have a discussion about certification, because this is where we have a problem. I looked up the steps for certification for a rehabilitation center. So the initial application is a written application. You have to state, what services you're providing, who are the personnel, where is it going to take place, so on and so forth. So before applying to the state, all of these rehabilitation centers have to get what's called a pre-accreditation. So there are several companies in the state of Maryland that offer this pre-accreditation. Whatever the center is, whoever they are, they have to pay to get this accreditation, right? So that this entity comes out to the rehab center, the proposed rehab center, and they check to see that all the requirements are satisfied.
Mm-hmm.
So this is sort of like a application, so to speak. So this accreditation center, so the rehab center pays the accreditation center, and then the rehab center goes to the state and says, okay, I've been pre-accredited by this organization. And then the state either approves or disapproves the certification. Now, this is an initial certification, which to my understanding, and I can be corrected, but according to my research, the pre-accreditation lasts about 6 months. And then there's a final certification that takes place. Now, prior to 2018, each of these rehab centers needed to recertify every 2 years, as far as I can understand from the material I read. But that recertification did not involve anyone coming out to the center to visit. It was only a pencil and paper recertification. So in other words, the rehab center has to send in a list whether any personnel has changed, did the address of the center change, were there any other major changes, so on and so forth. And that piece of paper would be handed in to the state. And, after that, they were recertified. However, and let me tell you what the organization is. The organization that's in charge of the certification is the Maryland Office of Healthcare Quality.
Okay, so Maryland Office of Healthcare Quality are the ones
Correct.
who are kind of the gatekeeper for these recovery centers.
Yes.
Or rehabilitation centers. How are how is this contributing to the 6,000 deaths?
So let me give you add to the timeline.
Mm-hmm.
One of the critical things that happened in 2018 under Larry Hogan's administration, the Senate passed a bill, the state Senate passed Senate Bill 108. In that bill, any rehabilitation center in the state of Maryland, as of July 1st, 2018, no longer had to be recertified. In other words, all limitations were taken away. And from 2018 on, July 1st, 2018 on, each
Once
of
you
the rehab centers that were certified no longer had to be recertified.
Okay, wow.
And
And
they don't have to provide any data as to either recidivism or the success rate.
the treatment
They
data.
don't have to provide a single bit of information to the public about how their organization is being run.
Okay, wow. And do we know whose bill that was? Senate Bill 108.
What did you say?
Do we know whose bill that was? Who sponsored that bill? Who passed? Who was the?
So I don't know exactly
I'll look that up.
who sponsored the bill. I pulled up a copy of the bill myself. I have one.
Okay.
I have the PDF, which I can send to you, and I can send to you the letter that was sent to the rehabilitation centers as well, notifying them that they no longer had to be undergo the recertification process.
Yeah, it'd be interesting to know who introduced that bill and who championed it, and because for it to enter the stream, someone has to file that bill, right? Well, if it passed the Senate. If it's a law now, it passed the Senate and the House, right? So it had to have sponsors in both chambers. But I'm curious as to who introduced and who thought it was a good idea that rehab centers that now can take public money in Medicare and Medicaid should not have to go through any type of oversight process on a regular interval. So once they were certified, they could remain an entity in good standing. And as you said, they don't have to give any numbers on the number of people you've seen, or we certainly don't want to have anything that's personally identifiable. But we should have some information that's quantifiable as far as who's.
Exactly right. I mean that's really the heart of the problem. So what happened once the ACA gave the green light to accept Medicare and Medicaid? That's when I think an explosion of these rehab centers started happening in Baltimore. I noticed it in my own neighborhood. We noticed that, there's an entity in our neighborhood that, has expanded exponentially. They own, I would say, upwards of 15 or 16 different properties in the Washington Hill neighborhood. And they just continue to buy properties and expand. And what happens is if an entity is nonprofit.
Are these commercial properties or?
These are residential properties. The entity that's in my neighborhood, they're purchasing all residential properties. These were once townhomes, brownstones.
Oh, wow.
So, yeah, it's and when I did some additional research, there's another organization called the Substance Abuse and Mental Health Services Administration. That's an important organization as well. They publish a national directory of drug and alcohol abuse treatment centers for every state in the union. So when I looked up Maryland, I saw listed 89 substance abuse treatment centers in this city alone. However, when I closely read on the website, I found out that the centers that are listed voluntarily, because in order to be on this list, you had to answer a survey. And if you chose not to answer the survey, you just won't be listed. So in fact, there are more than 89 rehab centers in the city of Baltimore, because I know for a fact that one of the entities that has tons of buildings in our neighborhood did not sign up to be part of the survey. So that leads me to believe there are other centers that are not part of the survey.
How many rehab centers are there?
The listed on this survey, which I can send you that document, listed on this survey, there are 89 in the city of Baltimore alone. And the other number that I found out were the methadone clinics. And in Baltimore, there are 51 methadone clinics in Baltimore City.
Now you're saying that those are the ones that are listed, and there could be some who are
Yes.
not listed. And so where do you go to find out how many there actually are?
Well, this is what I tried to do. And believe it or not, I could not find a single organization that could tell me for sure how many recovery centers there are in the city. So I called behavioral health systems in Baltimore, and I asked them point blank, can you give me a list of all existing rehabilitation centers? And when I say a rehabilitation center, they could be offering a bunch of different services. Sometimes they offer drug rehab and mental health, or alcohol rehab and mental health. So there are lots of different ones. But when I called up behavioral health systems, they could not give me an answer. They said, we don't have that list.
Right.
Now, maybe I was talking to the wrong person. Maybe I need to call again, but I can't imagine that they wouldn't have a list.
Right. Now, so help me understand. I'm trying to make the jump here from this conversation about recovery centers to 1,000 people a year dying. Where help me understand. Like, so how are they connected?
So what is missing is what is the effectiveness of these organizations? Because if you don't have any oversight whatsoever, which they don't, there's nobody walking into these centers, checking up there's no recertification process whatsoever. Right. So how do we know their level of effectiveness if there is no oversight, if no one's going in to recertify or even look at what's happening in these centers?
So Medicare and Medicaid is willing, well, I guess because this is it's a disability now, right? So they're required to pay for these services, but they don't have the right to ask about the quality of the services being received, I guess.
Correct. And
yeah.
and believe me, I've tried as a community leader to, get a local service provider to provide some data, because we notice in our own neighborhood an incredible uptick in people just nodding out on the street, drug dealing in our neighborhood, increase. And this is an increase over the past 10 or 12 years, we've noticed. But that increase has paralleled. And what I'm saying to you right now is inferences only. I can't, if I don't have data in front of me, I can't tell you exactly what's happening. But my neighbors and people come to me all the time saying, Maggie, can you help me with this situation? There's drug dealing going on in this one area in our neighborhood. How can we fix that? And we just notice a general uptick of people coming in, and I can tell you that a lot of these centers bring people in.
Yeah, that's the thing that I'm interested in, is that when you start saying things like there's an uptick, right? Because what I'd like to take a look at is the deltas, right? What's changed, and then what's causing the change, right?
Right.
So if there's an uptick, we got to ask ourselves, where is that change coming from? What is the difference in where it was as far as where it is now? Right.
So where it was is that these rehab centers would get a pot of money prior to the ACA.
Maggie, what I'm trying to figure out is that the difference has to do, I think has to do with our local approach to these things, right? So
Hmm.
are we what are we doing about drug dealing, right? As from a city standpoint, from an enforcement standpoint, what are we doing about the drugs that are being dealt, right? Because if you have open air drug markets and they're not being, if these things aren't being enforced, because I think what we're seeing is we have, an administration that was solely focused on one number, and that one number was murders, right?
Hmm.
And when your entire focus is, I want to get people to just stop killing each other, then what I and in the group also a while ago, I said, look, no one wants to see a high murder rate. I mean, that's just, no one wants to have that, in a city. You really, you hope for zero, murders. But at the same time, if you don't have the murders, then no one's going to pay attention to everything else. And the everything else is the drug dealing,
Hmm.
right?
Hmm.
The everything else is the explosion in these recovery centers, which are drawing people who are addicted. It's
Right.
drawing them into Baltimore.
Right.
And if we're not enforcing the law on drug dealing, and you have this influx of new drug addicts coming into the city to be a part of these recovery centers, then you're going to have more drugs on the street. And while, we may have safe streets out there asking kids, hey, don't kill each other, but they're not telling them don't deal drugs, right? So we haven't taken the drugs off the street. We got more addicts that are available. Um, and we got these recovery centers who, well, I mean, I know, I certainly appreciate your stopping short of saying it, but their business is to treat people who are addicted, right? If people became well permanently, then, they wouldn't have such a great business model. Uh,
Well, it's funny that you say that. I mean, what I was going to say is that prior to the ACA decision to allow Medicare and Medicaid patients who have substance abuse disorders to use their Medicare and Medicaid, prior to that, these centers would get a pot of money every year, as I understand it. They would get a pot of money, and this was your pot for the year,
right,
and don't spend more than that. But what changed then is that the center would get paid by Medicare, Medicaid, by the head, by the number of people that would come in.
right,
So,
right.
we've had people observe, um, van loads of people from other parts of Maryland being
Bucking
bussed into the city.
Right, 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 right. And yeah, so they're bringing them in from everywhere because, like you said, they're getting paid by the head. So that now these recovery centers that are now buying these properties for next to nothing in Baltimore, right?
Right.
In your neighborhood residences, not commercial properties, but residences. So they're buying these residences all over Baltimore, and now they're sending their vans out to who knows how far, right? Is it, could it be Pennsylvania? Could it be
Oh, well, yeah, I know at least, Montgomery County, Anne Arundel, Cecil County.
another
Yeah,
bunch
I
of these
mean,
in to give them treatment that they're going to bill Medicaid for, and if they don't become permanently well, they end up on the streets of Baltimore. Is that
well,
what?
this is what we've noticed. We've noticed an increase in homelessness even before
Right,
COVID, even before COVID. And of course, COVID, exacerbated everything. But,
mhm,
I want to say up front also, as a city resident, these centers are so important for the people who need the treatment. We're not, none
sure,
of us are saying that we shouldn't have any. However, what we want to see is oversight. We
right,
need to have these centers,
right,
ante up the data that they have, the
Right.
quality of treatment. People need to know
Yeah.
whether these centers are actually successful in
Right.
treating people. Because if we don't know that, then they're not doing their job.
Right.
That's all we want. We want to know that they're doing their job. And that legislation is going to have to start at state level.
Right.
Somebody has to introduce a bill
Yeah.
that is going to require these places to be recertified and examined for their level of success.
Well, and I think at some point the city, from a municipal standpoint, has gotta say, hey, what's the right number of these things? Well, I don't know that you can, you know, I don't know if there's a way to stop. Um,
No, there's no. Sadly, there is no way to
yeah,
do that.
I guess if
The centers cannot be denied any property that they
right.
want to purchase.
So at this time, I'm going to bring in Margo Bruner-Settles, who's way out east, into the conversation as well, because Margo recently ran for city council in the 3rd district.
Mhm.
And I recall one of your key elements of your key, components of your platform was around addiction and recovery and treatment. So I wanted to have you as part of the conversation, because we do believe, as Maggie just said, we do believe that these recovery centers have a place. The question is they can't, they can't run rampant and just be churning and bringing folks from all over the place into Baltimore City for recovery that ends up not working, and then they're put on the streets where drug dealing is basically legal in Baltimore right now. But you spoke quite a bit on the campaign trail about the need for the need for Baltimore to kind of model other jurisdictions in their treatment ideas. So I just wanted to have you talk a little bit about what it was, your
Yeah.
for.
Yeah, and just to piggyback a little bit off of what Maggie just mentioned, which I think is very important, and what I've heard also in my district is that it's not that people are rejecting these facilities because it's just they're not NIMBYs, they're not bigots, they're just concerned about the accountability piece and the appropriate management. So just to clarify, what I do, I'm actually a licensed clinical social worker. And I also have a qualification as a SAP, which is a substance abuse professional. So I assist a lot of individuals in recovery and getting them connected to treatment, as well as their return to duty process in that. And so one of the ideas and a very innovative notion that when I was doing critical incident stress management training, my CISM, was that in Anne Arundel County, they have a process and it's called safe stations. So at any time, anywhere, there's what they call 41 entry points. There's 41 locations. An individual seeking recovery can go into a firehouse, a police station, 24/7, weekends, holidays, and they can be connected to recovery. Also, they can call their crisis line and they will come to their location and get them connected to recovery. And so this is more, I see this as more preventive in nature as well. When people if you've ever worked with individuals who are, seeking recovery, who have a substance use disorder, immediacy is very important. Making sure they get connected immediately when they're ready, because that next hit, the addiction, it takes over. And so that's why I love this concept. In specific, it's this concept, safe stations concept, it's an innovative, integrated law enforcement, community-based mental health response to addiction. And and it's been highly successful. One of the things that comes along with addiction And just from as a mental health professional, we know addiction is based in mental health, right?
Right.
You have to address the psychological aspect, the trauma, and oftentimes people are escaping that through addiction. They're numbing the situation, they're numbing the past, they're numbing because
Right.
you're going to cope one of two ways, right?
Right.
Either in a healthy way or an unhealthy way, because what's in you is going to come out of you. It's just the way that you actually cope with the situation. And so it's a very interesting model, and it's something that I think the city would absolutely, hands down, would be very beneficial for individuals who are seeking recovery.
Now, you said that this is going on, and this is Anne Arundel County.
This is in Arundel County.
Are there other jurisdictions that have similar, things in place that you know of?
Well, I'm not certain about other jurisdictions because I was connected with, the gentleman's name was Steve Thomas, who did my training, and he's
Right.
the lieutenant who's
Yeah.
actively involved with Anne Arundel County's safe stations model.
Right.
And it's interesting to note, I do want to say this, that it is a clinician and a CIT officer working together. So the CIT stands for Crisis Intervention Training Officer.
Mm-hmm.
As of 2023 update, there in the crisis intervention team is comprised of 8 officers, 1 sergeant, and 1 lieutenant.
Right.
And they work closely with the clinician. The clinician, initially, when someone comes seeking support, right, there's an assessment, because it not everybody has the same level of treatment needs. And so they do a medical assessment in the event they need to go to, seek medical treatment first. And then from there, they develop a treatment plan. The officer, that's the clinician, of course. If the medical assistant part, the medical assessment comes from, the EMT professionals at the firehouse, or the clinician supports. They do as much as connecting them to benefits if they need social services or their IDs, things like that along the way in this process.
Mm-hmm.
The officer, interestingly, helps with legal issues. So oftentimes, because addiction is associated with crime and at-risk behaviors,
Right.
The officer will support the individual if they have a hearing coming up or a court date. They can, if they're in active treatment, they can assist with maybe postponing that or getting that connect. It really builds a more trusting relationship between.
Okay.
Between.
It's more than just a kind of a catch and redirect situation, right?
Yeah.
It sounds like there's because when I first was hearing about this, it felt like it was like, hey, I'll get you, receive you here, and then kind of put you over here. So it sounds like it's a lot more than that. And,
it's certainly hand holding the process, because if people are just they're just not, if when you're in active addiction, you're not going to sit down and take time to make calls and figure out this process of well, do I need insurance, do I have, and so it really simplifies with the immediacy of getting assistance, the proximity of getting assistance. And so to me, it takes all the difficulty of just getting help. And you can, like I mentioned, you can go into any police station, any firehouse, or just make a phone call.
Yeah,
they'll get you connected. And then certainly after the assessment process and support along the way,
sure.
They are connected to whatever is assessed, the what is appropriate for their recovery, whether that's inpatient, outpatient, intensive, outpatient. And let me share with you actually the success rate from what I was reading. It was a 70% of individuals, were engaged with the safe stations. Once they were engaged, they continued with the process. After 90 days, 51% remained sober.
Right.
And from 2017, they started around May of 2017, this innovative approach. And from mid 2017 to December of 2022, they did 5,131 assessments.
Right. And it's, well, I don't know if those numbers, I don't know what those numbers mean. I hope they're good, right? But
Yeah.
I think we're based on the conversation that Maggie and I were having, at least there's numbers. Well, and at least there's a process that we can see that they're putting the folks through.
Yeah.
And we know when they get someone into the program, we know what they're going to do or what they intend to do.
Mm-hmm.
And now they're reporting, how successful they were at doing it, right?
So I have a question. When you get done, Desmond, I have a question for Margo also.
Yeah. Go ahead, Maggie.
So I would like to know who's collecting that data. Where are they getting the data on the success rate? So in other words, are they being successful in just hooking people up for services, or are they following people for a term of months to see the eventuality of whether they stayed sober or whether they went back to using? That's number one. And number two, is the Anne Arundel Police Department fully staffed? Because one of the problems that we have here in Baltimore City is that our police department is seriously understaffed. Mm-hmm. So when you say they can go to any police station or any firehouse, to me that says these people need to be trained. So who's paying for the training? Is that a different program? How is that being funded? Because all of those things come into play when you have a special program like that. And I agree with you. I think a person who's using does not have the wherewithal to sit down and, go online and find places to go to and get themselves there. I totally agree with that. I just, and I'm really happy that the program's been in place since 2017, because that's a term of longevity. So that means that something must be working for them to consistently fund this project. So, it'd be interesting to know the numbers. That's all I'm saying.
And that I think would come best from the source itself, from those that are running the program, having those questions.
And who's running the program?
I learned about the program from Lieutenant Steve Thomas, who was actively involved in safe stations. When I had my CISM training, he was one of the trainers. And this was some years back, so it was fairly fresh, this program. And so I think that would be those specific numbers and operational details, those details operational will come best from him. I will say this, in my research and the article that he wrote, the journal article that was based on Anne Arundel County Safe Stations, also associated with addiction is obviously crime. And what they did notice is a significant reduction in 4 areas of crime. And this was 4 main crimes associated with addiction, which was robberies, burglaries, thefts, and thefts from vehicles, that they saw a dramatic decrease. And so those are some of the things that I think would come best from him responding, representing, the program and understanding more there.
And that makes sense, because if you're not using, you don't need the money to rob someone you don't need to rob someone to get the money to continue to use. So that data is definitely correlational in terms of that. So that, that's a good indication that the program's working. So.
Yeah.
Right. And if you're not using, then there's less of a market for the dealers, right? And if there's less of a market for the dealers, there's a lot more anxiety in that community. And when there's a lot more anxiety in that community, there's more violence. And so when you don't have, when your markets are plentiful, it's easy to be at peace. And what we have here is we're 700 police officers short, and that's not an accident, right? Because there's a deliberate effort for young people to not come in contact with law enforcement.
But what, that's right. And what I love about this approach is it is preventive. I think we as a city have become very reactionary after the fact, and this approach gets us ahead of the issues. It gets us ahead of preventing these crimes.
Who's implementing the project? You saying lieutenant of what? What is he the lieutenant of?
Lieutenant Steve Thomas. I believe he's the lieutenant of the crisis intervention team.
Yeah, but what's his job? What's his profession? Like, what does he do?
With Anne Arundel County Police Department.
Okay, so he's police.
Mm-hmm.
He's a police officer.
Mm-hmm. This is law enforcement, community-based.
Right. And that's the decided difference that we're seeing here in Baltimore. We have a mayor who despises police. He doesn't want police interacting with our youth or anyone really, right? So this program, even the Safe Streets, all of it should be run through a law enforcement agency. But these kids are not interacting with a law enforcement professional first, because as Monsi, Director Mavronis said, 80% of Safe Streets interactions involve a weapon. Like, somebody's got a gun, maybe both parties have a gun. 80% of them involve a weapon. Well, if you're a Safe Streets worker, what are you going to do about that weapon in that interaction? You're not going to do anything about the weapon. But if you're a police, you have to do something about that weapon, right? So what's happening is we have deliberately removed law enforcement from the interaction with the drug dealing community. So there's basically no inhibition for dealing of drugs. And what Maggie has been talking about is the supply of customers is coming from this influx of these unregulated centers, right? And these centers are buying up properties because now that Medicaid's paying, and we're not just getting a pot of money that we need to budget, we're getting paid per head, is what I heard Maggie say. So what do you do when you're getting paid per head? You got to go find heads, right?
Mm-hmm.
And so now we've got these kids who are not, we got this population of people who are unchecked because we don't want them interacting with law enforcement at all, or at least the administration doesn't. And then we have this industry over here that is incentivized to go get people who are addicted to drugs and bring them to Baltimore.
Mm-hmm.
I mean, it seems to me like a perfect combination for a lot of people getting their hands on a lot of drugs and overindulging. And Margo, it sounds like what you're talking about in Anne Arundel County is the law enforcement agency. I mean, who better to have a program through, right? A law enforcement agency has come up with a program, right, where they are intervening and getting the people, and at least by the numbers that you're reciting here today, is largely effective. So, Maggie, the problem is we'll never get we got $45 million in this opioid settlement, but we'll never have an administration agree to implement something like this through the law enforcement agency, where we could have accountability and structure and results driven.
Well, what I'm worried about, Desmond, is where that $45 million is going to go.
Right.
Because if the mayor or anybody else at City Hall is unaware, and I can tell you, I'm sure there are plenty of people that are totally unaware of the fact that these drug rehabilitation centers do not have to prove their effectiveness to
Right.
anyone.
Right.
That's crazy town to me.
Okay.
So I'm not saying that all. I'm There are drug rehabilitation centers in this city that are excellent at what they do.
Right.
So, and we know who they are.
Yeah.
They're excellent. And you can tell by their financials. If they're a nonprofit, they have to publish their tax returns, and you can tell the places that do a great job of getting out to the public, releasing information about their activities. Most of their income, a lot of their income, is grants and people giving them money, and that's reflected in their tax return.
Mm-hmm.
The places that are very secretive about what they do, you're going to see that they don't have a lot of grants coming to them, because people who give grants want to know that the entity that they are giving money to is successful at what they do.
Right.
So,
and you're talking about, I mean, is there a requirement for these recovery centers to be nonprofit?
No, they can be for-profit as well.
Right.
They can be for-profit, but if they're nonprofit, the added loss for the city is that they lose a tax base. So if there's an entity that's buying up residential properties, like an OR, areas of the city that are zoned OR or R, if they buy that property, they're nonprofit, they're no longer paying tax on that property. So in addition to all of the, I want to say, predatory developer practices that occur in this city, in addition to that, you've got nonprofit. Now, let's go back to the numbers. I identified 89 rehab centers. So it'd be interesting to dig a little deeper to see how many of those centers are nonprofit and where they're located. And how many buildings do they have? Because if they are identified with one address, it would be interesting to see, okay, then how many other buildings does this entity own in the city?
Right.
So that's something that the city, so I would encourage Councilman Conway to do the research on that, because that's going to take some serious research to do that.
Well, I mean, a lot of times, we just take, I've done a lot of research that I would just, present to the council people as well, right?
Well, unfortunately, we won't be able to do that because the councilman has initiated these 4 sessions, but the public is not allowed to give comment at any single one of them.
So and I hope that we get a chance to speak with the councilman about what about the specific schematics of these hearings that are planned, and I think as we led off with today, this onion needs to be peeled, and the administration's going to fight it from being peeled as much as they possibly can, but we need to have a council that has a little bit more of a backbone, and there are other topics we're going to be covering on City Voters Live podcast, which we hope will the power structure of Baltimore City more balanced, so that the citizens can get more transparency. Right now, this is a town that whatever the mayor says goes. I mean, that's just the way it's built. That's the way our entity's built.
Well, I would say to that, Desmond, it's not even, I mean, yes, the mayor needs to educate himself about what's happening, with these centers in his city. However, I think that, council members and the mayor have to approach the state to change that legislation to make these centers accountable for the services that they provide. Because until that happens, Desmond, until a light is shined on all of their activities, there's really very little that we can do. We can uncover it. People can do the research, but the
Right.
law also has to be
We understand.
updated.
Well,
Because you're dealing with human lives here. Come on now. We want these people. We want people to get well.
What I want to know is who put the law in place and why. Right.
Well, yeah, that would be a good thing to, and I'm sure that's something that that can be researched, because that happened in 2018. That's not too long ago.
Senate Bill, you said Senate Bill 108 is what it is. So we're gonna look up Senate Bill 108 and find out who the sponsor of Senate Bill 108 is, and we should be able to tie together, because usually bills like that are pushed by specific lobbyists or specific organizations that want those things, and we'll see who was influenced to pass such legislation, and that's how we start. It's how do we get here in the first place, right? And then figure out how to undo it. But yeah, so yeah, this has been a great discussion. We have 1,000 deaths a year so far. I mean, I guess if we're doing it on averages, but I mean, the things that I'm hoping the hearings will uncover is, whether or not there's patterns, right? So at some point we had X amount of overdoses, and at some amount we started having Y amount. What contributed to those changes? Was it the deregulation? Was it the deregulation of recovery centers? Was it the change in the revenue model for those centers? Does it have to do with the fact that laws are optional in the city of Baltimore right now? There's always going to be a combination of things that have you ending up where they are. But the point is, wherever we are now, we've been headed in that direction for quite some time.
Yes.
And it is a damn shame that we have people in our government that would purposely keep those things from us as the citizenry. Like, you can feel the change in your neighborhood. Like I said, you being down in Southeast Baltimore, you're going to feel it a lot more than I will all the way up here, in Northwest. So you've been feeling what's been going on, and as a neighborhood association president, you've had people coming to you saying, "Hey, these things are happening, and I can't figure out why." But what
would be interesting, Desmond, is another piece of research that would be interesting would be to see if there is a parallel between the increase in the creation of drug rehabilitation centers in the city of Baltimore and the change of the law. So in other words, in 2014 is when the ACA law changed to accept Medicare and Medicaid. So from that point on, from 2014 to 2024, it would be interesting to see whether there's a parallel rise in the establishment of drug rehabilitation centers since that law was passed. Because I can almost bet you that you're going to see a sharp increase that parallels actually the deaths as well.
You're going to see that, because that period is when, like I said, the revenue model for those businesses changed in 2014, that they're not given a pot of money, they're given a per head amount. So what are you going to do? You're going to, one, build the facilities, and then two, you're going to go out shopping for heads. And now you've got all these additional people being, as you said, bussed in these vans and shipped in from all over the place, because, this is... And
plus the people that are in the city as well. I'm not saying that all of them come from the county, but yeah, we have city people too.
Of course. But, like I said, that's adding those additional bodies here. When you combine that with the policies from a law enforcement perspective, and the desire to exclude law enforcement, or exclude our law enforcement agencies, at least, from the law enforcement process. So you got the supply side and the demand side just coming together, making this great, this great storm of addiction and recidivism. I'm sorry. Go ahead.
Yeah, and I think that a preventive approach, such as safe stations, and then appropriate management and accountability to provide quality treatment to those seeking recovery is definitely a start.
Mhm.
It's a huge start, and holding them accountable, because it's just it's so vital. I mean, all of us here, I think we all want what's best practice, and that shouldn't be a lot to ask. We just want
Right.
best practice. And I certainly, with the 45 million that the city was recently awarded, I would think that would go into some of these more innovative practices of prevention, as well as developing that accountability, that management. I will say, from the law enforcement perspective, they are required under the consent decree, right, to receive mental health training, and things of that nature. So I know that we are understaffed, and so my hope is, that maybe we can condense the same training with mental health and addiction and recovery, because it goes together anyway, and
Mhm.
so just that's where I think, as the city, we need to start. We need to have a
Mhm.
response. We need to make sure that we're managing appropriately, but certainly, because I am always preventive in nature, I think we always need to get ahead of the issue as opposed to just reacting. Um,
Mhm.
we need to really think like that, preventive, when it comes to a lot of our social issues in the city.
Right. No, I agree, and I really hope that's the avenue we go down. Um, and but we'll see. I don't like the way things are starting. I mean, I think everyone in city government should be welcoming, this opportunity to explore this crisis.
Mhm.
But what we've seen is, the story be suppressed until after the election. What we've seen is the desires for council people to hold hearings on this, to be squashed. But you know, we can be hopeful about what will happen with that $45 million. But I think it is good for us to discuss openly, what could happen, right? Because what will happen, um, I think we do have the ability to impact what will happen, but it's going to require a lot more, people than the folks on this podcast today to be demanding that happens. And I think I don't know how much you know how much attention will this actually get uh, from the people of Baltimore City. Um,
Well, I'll tell you, Desmond, people, you know, uh, let's get back to the comment that I made on city voters. I've already
mhm,
gotten a couple of people calling me up saying, Maggie, can we get together? I want to know more about this,
and
because people all over the city don't know about the recertification, the lack of recertification for these places. And
yeah,
just as Margo said, she said something that rings very true, in that everyone who is addicted needs a different level of intervention.
right,
And a lot of times, if we don't know whether these rehab centers, especially the large ones, because there are a couple of them that are quite large. If we don't know the level of intervention that they're giving, the quality of intervention, whether they're actually differentiating the
yeah,
type of intervention that they are giving to patients, you know. One neighbor, one person from Brooklyn mentioned to me that people attend the center for 30 days. If you make it, fine. If you don't, sayonara, see you later. And we can't have that. That's got to stop. And the only way it's going to stop is if these centers are required to share their data. And that has nothing to do with invading a person's personal space. The data can be totally anonymous,
right.
you
Not
know. And
personally
yeah,
liable.
Yeah.
Now, you think that regulation you feel like it has to come from a state level, not a municipal.
Yes, it's got to come from the state. And I already, I mean, I discussed this whole situation with Bill Ferguson a number of years ago, actually now. And he was the one that told me that that's got to change at the state level. I mean, he didn't even know that these centers didn't require recertification once they got certified. So, that's been known by people at the state level, yet no one has really done anything about it. Every once in a while, I'll, nudge, people at the state level saying, look, we still have this situation. It's still growing in Baltimore. And what can we do about it? Right. And, my only, maybe it's not glamorous enough for the politicians to take this on. And I have to say, this would be a difficult, down and dirty type thing to get into, because it's going to take a bunch of research, a huge effort to change the law, and not make it seem like the state is, sort of, coming down on these places. That's not what it's about. What it's about is making sure that people in need get quality care 100% of the time. Right. Not just, when, because if we don't know what's going on inside, you don't know what you don't know, right? So that's what's got to change.
Right. Well, we'll see what happens next. I think the scheduling of the hearings is a good start for city government. We'll see if those hearings stay on the stay on the calendar. We've already seen some move off the calendar, but
really, oh
yeah, I believe McRae had scheduled some a hearing or on this, and it was canceled.
Well, I think they should be asking for citizens' input as well, because the citizens of Baltimore are being impacted by this as well. People that are living in areas that, there are people that have contacted me that feel that their area is being overrun by centers, and it does. It impacts the neighborhood as well.
And I'd be certainly interested in hearing, directly from Councilman Conway what it is they hope to learn, and what are they seeking from the agency and agencies, I guess, with what he has planned, and also put him on, ask him when will the public have an opportunity to weigh in? What's the law? What's his plan from that perspective?
Yeah, and I think too. I think everyone's perspective from a interdisciplinary approach is very important. Not the community, service providers, social workers such as myself that provides the assessments. Because I know for me, I don't refer to any treatment. We know which ones provide quality care.
Okay.
We from the service provider's perspective, and so I think having everyone's perspective is very important in moving towards solution and certainly accountability.
Excellent. Well, certainly thank you, ladies, for joining City Voters Live podcast this morning, and look forward to continuing the conversation. I think obviously we have the group that we can certainly bounce things back and forth on in Baltimore City Voters Facebook group, but we need to continue to have these types of discussions and bringing more people into those discussions. So if you run across anybody in the community that have perspectives or thoughts on this particular issue that you think should be expressed here on City Voters Live podcast, please let me know. Or if there's anything additional that you find that you want to share, with the group and the city, we'd love to have both of you back at any time. So if there's any last thoughts you want to leave with the city voters group.
Yes, do your research. Do the research. That's just so important.
Yeah.
Data talks, nobody walks. Okay, that's really what it's about. And if you don't do the research, then you are covering up your ears and blinding yourself. So we need to know what's out there and know what the law is and follow up.
Yeah,
exactly.
Just from intervention perspective, because we don't have safe stations in place. If you are a loved one, if you're seeking support, if it's a mental health concern, please know that there is a 24/7 hotline, 988. They will talk with you, support you in any type of emotional distress or concern. And I would also say contacting 311 if you are seeking, recovery services. That's a start. If you don't know where to start, at least we can start there.
Excellent. Thank you both so much, and I look forward to having you back.
Thank you.
Have a good afternoon.
Thank you, Desmond. Have a great day.
Thank you.